Okay.
late 50s.
All right. So you and I have talked quite a lot about mobility.
Yes.
And in your different roles that you've seen helping patients move with equipment and without equipment. Can you tell me, first of all, from a patient perspective, what was the difference for you? You've been moved when people move you manually, and you've been assisted to move when people move you with safe patient handling equipment. Can you tell me the difference for you as a patient?
Well, part of the being a larger patient is you need to have confidence that the person knows what they're doing and is capable of what they're doing. And if you get people in there and they send 2 or 3 people in, you tend to use things like limbs as handles, which is very dangerous. So you can, especially if you pull up on arms, or grab underneath here, or you can do nerve damage or anything like that. When you use patient care equipment, the patient, as a patient, your confidence level is a lot higher. You feel like when you're safe, you feel like you can extend a little more your efforts and you can do a little more than you would normally do, because if you're constantly worried you're going to be dropped or in my case with the broken ankle, completely non-weight bearing for close to a year altogether. So you really need to have that confidence and that you're not going to put any weight in that ankle, because you don't want to lose months of work that you put in. And I basically had to rebuild the ankle. So with the equipment, there's no possibility that you're going to get dropped, that somebody's going to get fatigued or slip or something. You have that safety level, which certainly makes safety completely negates the lack of confidence that you would have with a person, because they can always drop you, or they can slip, or they can have a weakness of some sort. And I think it also gives the staff member more confidence, so they tend to give that off to the patient too, because if the staff member doesn't look confident, it's going to come through. As somebody that was a staff member and also a patient, you can see that with people, especially with being a larger person than I am. So sure, absolutely. I would say the mobility equipment is 100% better.